The brain serves as the main center of processing information for the nervous system. It can be damaged by impact with the skull, and so is suspended in cerebrospinal fluid, which is produced from ventricles within the brain. Cerebrospinal fluid, or CSF, is a colorless solution which is similar to plasma. The fluid is formed as ependymal cells in the walls of the lateral ventricles secrete sodium, creating an osmotic pressure which draws water into the space. Chloride diffuses into the cerebrospinal fluid following sodium to maintain electroneutrality. Thus, relative to blood plasma, CSF has similar salt concentrations but lower protein and glucose levels. Through vascular pulsing of the choroid plexus, the fluid is then pumped out through the ventricles. Once it exits the fourth ventricle, it forks to flow around the spinal cord and the brain through the foramen Mengendi and the foramen Luschka. The liquid traveling around the spinal cord also returns to flow around the cranial subarachnoid space, where it travels through the arachnoid villi and into the superior sagittal sinus to be absorbed back into the vascular system through the lymphatics. The ventricular system is made up of a collection of cavities. Each ventricle is connected by canals named foramina. In the order by which CSF travels through the system, each hemisphere of the brain contains a lateral ventricle. The interventricular formula connects the lateral ventricles to the third ventricle, which in turn is connected to the fourth ventricle via the cerebral aqueduct. At this point, the ventricular system splits into the subarachnoid space in the spinal cord, the central canal, and the rest of the cerebral cortex. Other important structures in the ventricular system are the arachnoid villi, the arachnoid granulations, and the internal jugular vein, all of which serve to help train CSF to maintain equilibrium.
The buoyancy effects of the CSF reduce the weight of the spinal cord and the brain by 95%. The average adult brain weighs 1500 grams, however the net weight once suspended is dramatically reduced to 25 grams. CSF acts as a liquid cushion for the suspension of the brain. Without CSF, there would be a cut in blood supply in the spinal cord due to the pressure caused by the weight of the brain on the spinal cord, resulting in a blockage and would lead to the death of neurons. CSF acts as a cushion for the brain by dulling any force by distributing it throughout the fluid itself. There is also a small gap between the brain and the skull itself, which means if any impact is to occur on the skull, that the brain does not immediately collide with the skull. There is reduced pressure exerted at the base of the brain due to its suspension in CSF. This reduced pressure comes from the buoyancy effect of the CSF, reducing its weight force from 14.7 newtons down to 0.25 newtons. The CSF also provides lubrication between surrounding bones, brain, and spinal cord. Continuous production and excretion of CSF is required for normal brain function and prevents inadequate flow of blood to the spinal cord. Due to CSF circulating the brain due to the ventricular system, it is an ideal medium to maintain the chemical stability of the brain by removing waste products and providing all the nutrients the brain requires. These waste products can include electrolytes, excess neurotransmitters, toxic metabolites, and other drugs. CSF also uses the blood-brain barrier to enter metabolic waste from the central nervous system, which allows for homeostatic regulation of neuroendocrine factors. CSF can also act as a transport medium for hormones. These hormones function to control metabolism, mood, and reproduction.
Lumbar puncture is a process conducted to obtain cerebral spinal fluid. The fluid is then tested for the diagnosis of various neurological diseases. This process involves the extraction of fluid from the spinal canal. However, before the process is conducted, anesthesia is injected into the subarachnoid space. Firstly, the patient is asked to lie down sidewards. Then, a needle is inserted between their L3 and 4 vertebrates. The needle extracts the CSF carefully. This sample is then analyzed in a lab to diagnose various diseases. The examination of CSF can also assist in the determination of spinal fluid pressure. However, there are many negative impacts that can occur if this process is not conducted carefully. Some main impacts include damage to the spinal cord or brain, which can be a threat to the patient's life. Also, analysis of CSF is used to diagnose diseases in the central nervous system. There are 4 main categories, which include infectious disease such as fungal infection or tuberculosis. The second category is hemorrhaging. This is the bleeding in the intracranial area. Examples of this includes strokes or high blood pressure. Thirdly, CSF is used to detect disorders in the immune response. And finally, tumors are also diagnosed by the analysis of CSF in the brain or spine.
So by now you should know what are CSF and the ventricular system of the brain, their functional implications, and some of the clinical significance. Now let's look at the specific medical condition related to the circulation of CSF and the ventricles. Under normal condition, a balance exists between the production, circulation, and absorption levels of CSF in the brain's ventricle. However, when an imbalance occurs in the distribution of CSF, this condition is known as hydrocephalus. In this part of the video, we will look at the causes and types of hydrocephalus, how it is diagnosed, and the treatment option for this condition. Causes and types. There are 3 types of hydrocephalus. Non-communicating hydrocephalus, also known as obstructive hydrocephalus. It occurs when CSF flow is blocked within the ventricular system. Communicating hydrocephalus, non-obstructive. It occurs where there is an inadequate CSF absorption. Normal pressure hydrocephalus, where the increase in the amount of CSF in the ventricles has little or no effect in the pressure inside the head. This is very often seen in elderly people. Now, how can we tell if someone has hydrocephalus? What are the symptoms? Because hydrocephalus can cause damage to the brain, thoughts and behavior may be adversely affected. It may result in learning disabilities, emotion and visual problems. In infants and toddlers, hydrocephalus results in an enlarged cranium because the young skull bones have not yet fused. In adults, fluid pressure quickly builds up and damages the brain because cranium is unyielding. It may lead to poor coordination or even personality changes. In the case of normal pressure hydrocephalus, it is hard to diagnose because elderly age patient presents mild dementia symptoms similar to Parkinson's and Alzheimer's disease. The patient may also experience gait disturbance and impairment in the bladder control. So how can we be sure if someone has hydrocephalus? That's right, brain imaging techniques. By undertaking an MRI or CT scan, the enlarged size of the ventricles in the brain will show up in the scan. As you can see, the image on the right shows the dilated ventricles due to the blockage of the flow of CSF. Other ways to diagnose hydrocephalus are CSF scans and tests. Now let's look at the treatment option. How do we fix this problem? Hydrocephalus treatment is surgical. It's involved the implementation of a shunt. A shunt is a device that channels CSF away from the brain to another part of the body where it can be absorbed. There are a few types of shunt: the ventricular shunt, lumbar shunt, and the right atrium shunt. They drain the fluid from the ventricles or the lumbar space of the spine to the different parts of the body. Another treatment which is used to treat hydrocephalus is endoscopic third ventriculostomy. It is a surgical procedure that focuses on relieving the buildup of CSF pressure. A tiny perforation is made in the wall of the third ventricle using an endoscope, allowing excess CSF to drain into one of the body's normal CSF space. But how effective are these two treatments? About 1 in every 1,000 babies is born with hydrocephalus. Fetal onset hydrocephalus is one of the most challenging pediatric diseases. Currently used surgical treatment, as mentioned before, is inefficient. There are possible complications that can lead to a failure of shunts and the close-up of the hole after ventriculostomy. They also introduce infections after surgery. As you can tell, there is a need to advance the search for new treatment. This recently published article in March this year suggests that stem cell therapy can be an alternative treatment with fetal onset hydrocephalus. Studies have shown that hydrocephalus is a pathology of neural stem cells. Therefore, transplantation of neural stem cell is emerging as a great hope to correct brain maldevelopment, helping to reduce the brain damage and promoting regeneration and repair through direct cell replacement.